Hello, my name is Bonnie Decker, and I'm the new Executive Director of Healthy Community Brookfield. It is my great pleasure to serve you in this position today and to share with you, the board, a newly revitalized plan for HCB's future. Let's get started. As you're likely aware, HCB is a 501c3 tax-exempt organization funded primarily through state and county contracts and grant cycles. We have a focus on prevention, public health, and wellness services, and we have 97 employees that carry out that role and work in 13 separate program areas. Brookfield County is primarily rural, with one large city, Dakin, and the primary industries are agricultural, manufacturing, and government. We have many supportive partners such as the local hospital, health department, visiting nurse agency, primary care providers, a school, law enforcement agencies, and many other smaller community organizations that we work with to provide this care. I've created a chart here, an overview of all of HCB's programs. Some of our programs are more medical-based than they are preventative in nature, and I've marked those with an X. For example, the Women's Health and Primary Care, the Newborn Program, or the Elderly Case Management after discharge. Many of these services are duplicated in the community, and some of our key partners, such as the hospital, the primary care provider offices, are questioning why there's two separate programs. There are some programs that are at risk of losing funding due to grants expiring, the diabetic education program and the well water testing program, and then also others that are at risk from losing funding from the county contract if Domain 9 accreditation standards aren't met, and those are also marked. You'll see a small asterisk next to well water testing. A group of our constituents, one of the largest groups actually, which is currently under stress from the financial demands that HCB places on them to be compliant with the well water testing. And this is an area of contention that they're expecting resolution on. There are many environmental factors that are currently affecting our organization. Many of our partners and people in the community would like us to have a clear sense of direction. They view us as a ship without a sail. They're frustrated by the duplication of resources, and they would like to have a resolution of the well water testing issue. Our partner at the county would like us to be compliant with Domain 9, or they may not continue to be our partner. There are economic considerations. Not only is HCB struggling financially, but so are the partners that we work with. Our increasing demands on the county, who are already cash-strapped, is insecure for us and frustrating for them, and it doesn't help our relationship. We have a political climate in which many of our partners have asked us to take action, whether it's through streamlining services, clarifying what we do, or resolving problems. We have competition between our programs and others, strained finances, and again, we're viewed as a ship without a sail. More and more people in the community no longer understand what role we serve here. We performed a SWOT analysis to determine where the strengths, weaknesses, opportunities, and threats of our organization are. We have many strengths to be proud of: a competent and trusted workforce, a well-connected, respected board, positive image from the community. We're viewed as a good place to work. We're a freestanding agency, which allows us to be nimble, independent, and self-determining. And since new leadership changes in 2008, we have increased financial stability from where we were. However, we do have some weaknesses. We're often confused with other partners, which is a branding issue. We have inconsistent funding cycles that leave many of our programs at threat. We have a lack of data-based program planning and a perceived internal hierarchy where some employees are viewed more highly than others. We have unclear mission and values, and a lack of board term limits, which doesn't provide us with a fresh perspective. There are larger issues, threats. The loss of county partnership if Domain 9 standards aren't met for the accreditation process, financial liabilities, strained community relationships, and external awareness that our mission and values are not clear. However, we also have opportunities, and I'm pretty excited about all of these. We have great community partners who are looking to us right now to find ways to streamline resources or share resources or potentially let our programs blend with theirs. We have the FAB accreditation, which is an opportunity to lend legitimacy to the work that we do and give us a reason to reform our organization from a quality improvement standpoint. This is a challenge. This time period is a challenge, but it's also an opportunity to transform. I'm excited to share with you a new mission and vision. HCB's previous mission statement was reflective of where it was at the time in its role of finding preventative services that were lacking in the community. However, I'm excited to share with you a new mission statement that really puts HCB in a leadership role of coordinating resources and ensuring that those are met in the county. The new mission statement is, Healthy Community Brookfield ensures delivery of essential public health services in Brookfield through community-led engagement, local partnerships, and population-based outreach. This new statement reflects the future of public health with population-based services. It also underscores the importance of our community by helping them participate in where our needs are identified and also through local partnerships. If it's met by a local partner, we can consider it a job well done on our part and let that service go, and then move our resources to where it's needed most. Our vision statement will be every Brookfield citizen will have adequate access to health and prevention services, making Brookfield the healthiest county in the state. This, to me, is a really big change from where the previous vision statement was. Again, it sees a bigger, more encompassing and concrete vision of what HCB's future can be. Now for the best part, the 5-year broad strategic plan. I've found 4 areas in which we can move forward to transition HCB into its new role. First, we need to provide ourselves and our stakeholders with a clear sense of identity and a new direction through adoption of a new vision, mission, and strategic plan, and a focused media campaign to share those efforts. Secondly, we need to ensure FAB accreditation status and establish a culture of quality improvement within our organization. Thirdly, in accordance with the mission, we need to ensure that the current needs of the community are being met by forming coalitions with key partners and utilizing evidence-based data to accurately understand community needs. Finally, we will establish a more secure financial position by generating efficiency with lean methodology and seeking out new and creative ways to establish funding. So I'll take these one by one. First, creating a clear sense of identity. Of course, we'll adopt a new mission, vision, and strategic plan, and then we'll disseminate that information internally through an all-staff meeting to get our employees on board. And from there, share it externally through a marketing campaign to gain buy-in from the community. The person responsible for this effort will be our current Director of Public Relations. She will need approximately 2 years to implement this plan, and the resources required for this will include approximately $50,000 for rebranding, creating a new logo, and getting our marketing services out to the community. Potential barriers could include changing an internal culture, which has been used to the HCB of the last 20 years, and also selling the new face of HCB to a community that already does not know who we are. Although, if they don't know who we are, it's a good time to give them a new face, right? We can mitigate this through an all-staff rally meeting where we clearly lay out for our employees the benefits of doing this, and also through a targeted media campaign that helps our community understand who we are. The stakeholders involved with this will essentially be everybody: community agencies, employees, board members. If we were viewed previously as a ship without a sail, this is the time to get all hands on deck. We can evaluate our progress in this measure through a staff engagement survey and also through a community survey to see how we're doing. Secondly, securing accreditation status. This will be done by hiring an accreditation officer whose sole responsibility is getting us on board with the accreditation process. That person will develop accreditation committees in the areas of performance management, workforce development, and quality improvement, and use performance metrics at a program level to get all programs on board with our mission, vision, and values. The person responsible for this effort, again, will be the accreditation officer, and that will require a resource of approximately $70,000 a year plus benefits for that person's salary. The timing of this will be done by autumn of 2019, as the county hopes to submit their application for accreditation by year's end of 2019. Again, potential barriers are staff resistance, which will be mitigated at an all-staff meeting, And then also the use of staff involvement on committees, which will be helpful because they'll be a part of this process. The county will also need to accommodate our request to extend our deadline to meet the requirements. I've already spoken with their director. He's willing to give us a second chance as long as we can show our current plans and efforts and check in with him periodically throughout the process. Stakeholder involvement will involve the county, who will be updated, and also our own staff. And fortunately, a part of the accreditation process is evaluation. The whole point of performance metrics is that evaluation is intrinsic in the process. Next, we meet community needs with community input and evidence-based data. We do that through the performance of a CHA and CHIP, a community health assessment and a community health improvement plan. The best part is this is at no cost to us because the county is already doing this as part of their accreditation process. We just need to use those results to determine where the community's needs are the greatest. We can do this through forming a community advisory council with our key partners. And also, we can eliminate redundancy when programs are identified as redundant by the community and shift some of those resources and financial costs onto some of our partners who are willing to take them on. The person responsible for this effort will be the Chief Operating Officer in conjunction with several other key people at the leadership level, such as directors. The timing of the action plan will be in 3 years, so in the year 2021. It won't require many resources, but I put a nominal amount of $2,000. If anything, this will be a cost-saving strategy. Barriers will include regaining trust and strengthening our partnerships with the community, and we can mitigate that through cooperation with the Community Advisory Council. Stakeholders involve all local partnerships and, again, particularly local health. We'll know that this strategy was successful when the completion of a CHA and CHIP and the use of the analysis of results have occurred, and also through surveys of the Community Advisory Council and community satisfaction surveys. Next, we need to establish a more secure financial position. I propose we do that by becoming familiar with lean methodology, by sending several of our directors and key leaderships and programs to become lean certified. We will do a cost-benefit analysis to analyze what each program is contributing and how it fits in with our current mission, vision, and strategic plan, and we'll streamline our resources. We'll also aggressively seek donors and develop a foundation in which people can make tax-deductible donations to our organization. And we'll utilize a grant writer to seek new grants once we become FAB accredited. The people responsible for this process will be our Chief Financial Officer, our current grant writer, and a new foundation coordinator, which could be a half-time position. The time frame for this will overall be 5 years. Lean training will cost about $7,000 for 7 leaders, and the foundation coordinator will be a 0.5 FTE at a salary without benefits of $35,000 a year. The barriers are the fact that FAB alignment is essential, so that we need to make that a priority. And we also need staff buy-in. If we can ensure their employment with other agencies, if we no longer employ them and make that a stipulation of our contract, we can reassure them. Stakeholder involvement will involve the recruiting of donors, and we'll evaluate it by ensuring that lean training is done within 8 months, establishment of a foundation by 2021, and to have a set amount in the black by 2021, once we've determined which programs are going to stay and how our budget is looking. The next steps for you, the board, are to adopt our mission, vision, and strategic plan, to approve a budget so we can move forward, and then we can hire an accreditation officer and foundation coordinator. I'd also like to implement annual operational planning meeting, so in addition to our monthly board meetings, annual meetings to keep us on track with where we're going with our strategic plan. In conclusion, we need to be united and clear on our mission, vision, and strategic plan. We need to share our identity with the county and its leaders, ensure FAB accreditation is met, create a quality improvement culture, utilize community empowerment and evidence-based data to drive our efforts, generate efficiency, and ensure financial stability. I believe by doing these things, we can guide HCB into its future leadership role in the community. I'm excited to take that step with you, and I'll now answer any questions that you may have. Thank you.